Good afternoon, everyone.
Good afternoon, all. So, this is Rupesh from Peak Health Studio, Chennai. I welcome you all for the program EXRX India presenting for the students by the students webinar series. I welcome Dr. Chandramohan, founder of EXRX India, Professor Duna from Dusat Creations, West Bengal, and finally, I say my gratitude of thanks to Mr. Sampath Kumar, CEO of Sri Samraj Health Service Private Limited. Here, I take this opportunity to welcome all the students, resource persons, as well as viewers, those who are viewing this for the students by the students webinar series. So, this program is not a competition, but to bring out self confidence and public speaking. So, today's first topic is presented by Ms. Vidhi Dave from Mumbai on the topic treatment of amblyopia, the scope of physiotherapy in treatment of eye pathology. Ms. Vidhi Dave, you can start your session.
Thank you, sir, for introducing me to everybody. Good evening, everyone. My name is Vidhi Dave, and I'm from Mumbai. I'm going to be discussing with you today the treatment of amblyopia. Amblyopia, a condition which is not very well known to us physiotherapists. So I chose this topic because I thought it would pave a way for us to understand a little about our role in eye pathologies. I thought it would be interesting to learn for us physiotherapists. So moving forward with what is amblyopia. Now, amblyopia is very common visual impairment. Okay, when I say the term lazy eye, a lot of y'all would have heard about it. So lazy eye is actually a layman term for this medical terminology, amblyopia. Amblyopia is a neurological condition wherein the brain does not really acknowledge the image formed by one of the eyes. To explain it to you in simpler words, how after stroke in unilateral neglect, the brain does not really acknowledge the movements or does not have awareness of one side of the body. Similarly, because of some issues in the brain does not acknowledge the image formed by one of the eyes. And that is when we called it as amblyopia. So the eye's image, which is not appreciated by the brain, is the amblyopic eye, and the other eye continues to work normally. Now, because the eye favors and relies on the image formed by the normal eye, the visual performance in the affected eye slowly keeps on deteriorating, and thus the visual performance in that eye decreases. Now, amblyopia is very prevalent throughout the world. We see that 0.2 to 5.3% of children, these statistics that I'm showing are of the children specifically, is 0.2 to 5.3% throughout the world. In southern India, we see 1.1% kids having amblyopia. Uttarakhand shows 8.6% prevalence, and urban and rural Maharashtra shows 0.8 to 0.2% prevalence respectively. Now, what are the types of amblyopia, or I can say what are the causes of amblyopia? There are these four main causes which leads to lazy eye. Talking about anisometropic amblyopia. Now, what happens is a lot of us have glasses, right? But not many of us have equal numbers in both the eyes. So when we say there are different numbers in different eyes, it means that the refractive error in both the eyes is different. When refractive error in one of the eyes is more worse than the other, that's when that eye slowly turns into a lazy eye, and the eye and the brain relies on the image formed by the relatively normal eye. Okay, so when there is refractive error difference in both the eyes, the one eye with the worst refractive error becomes the amblyopic eye, and this type is called the anisometropic amblyopia. The second type is the strabismic amblyopia, wherein which occurs due to some abnormality, structural abnormality in the eye, and because of this, the visual performance in that eye decreases. Now that eye turns into a lazy eye. Similarly, there is something called as the deprivative amblyopia, wherein which is caused by the obstruction of the light falling on one of the eyes, and which is why the image from that eye is not formed well. So we call it as deprivative amblyopia. Mixed amblyopia is another type when any of these three could be more than one of these types could be present in a person together. So these are four main causes why lazy eye or amblyopia could be caused. Now, what are the signs and symptoms of amblyopia? Just quickly brushing through it. I'm not going to be taking time in explaining the common symptoms that we usually see in any eye pathologies. These are headache, watery eyes, and blurred vision. So these are something symptoms that we really usually see in most of the eye problems. But apart from that, amblyopia also presents with issues with visual acuity. So vision 6 by 6 is considered as the normal vision. It is usually checked by Snellen chart. Okay, so visual acuity means the clarity of the vision. So visual acuity is usually affected in amblyopia. Even the near vision, which is tested by a handheld chart, is affected in amblyopia. Refractive error, as I explained earlier, the difference in the angulation of the light falling on the retina, giving a different type of image, is the refractive error. So the problem in refraction, that is the refractive error, is one of the symptoms. Then there is double vision. So the person may see two objects or images instead of one, that is double vision. Then there is contrast sensitivity. Contrast sensitivity is the ability of the eye to distinguish something from the background to something that's overlapping it. So here, when you ask the person to read whether the letter is written in the lighter font, the person may not be able to read it. So that is a problem with contrast sensitivity. Next is fixation stability. So fixation stability is the ability of a person to fix the gaze onto one point. So if the child is not able to do this, we call it as fixation instability. Then there is peripheral vision. So what we see here in blue and yellow is the peripheral visual range. Okay, and the one that we see in green is the fixation stability, fixation gaze. Okay, so the peripheral vision is usually 90 degrees on both the sides. So it's almost near to 180 degrees. Then there is accommodation. It's the ability of the eye to keep changing its focus from something that's near and something that's farly present. So changing the focus from near to far and far to near is what we call as accommodation. Then there is something called as convergence. That is when we can adduct both the eyes together towards our nose. That is something we call as convergence. So in whenever we see inability in these these functions of the eye, or whenever we see any problems or issues with these particular parameters of eye, these are usually indicative of amblyopia. Everything may not be present in the patient, but these are things, parameters that we usually check in patients with amblyopia. Now, there are some few facts that I thought I could put for amblyopia, since this is a new condition for most of us. One, treatment of amblyopia in physiotherapy can work on the principle of neuroplasticity. So as I speak further, I will explain how this works. Amblyopia can also be improved and treated with appropriate treatment, provided it is started early. So the earlier we start, the better is the prognosis. We also need to notice, as I already mentioned earlier, that amblyopia is a neurological condition and not a pure ophthalmic condition. But it shows problems or symptoms in the vision or the eye. It is also seen in adults and not only in children. So this is also a point to be noted. Moving further on treatment of amblyopia. So I've divided the treatment of amblyopia in three main classes. One is the older treatment approaches. Two is the virtual treatment approach. And three is the conventional exercise approach. So depending upon what your child presents with, how severe is his condition, what are his likes and dislikes, and whatever you feel is appropriate for your setting, clinical setting, you can choose. These are all the options that I'm putting in front of you. You can choose what is appropriate for your patient, and then you can accordingly start the treatment for your patient. So talking about the first one, that is older treatment methods for amblyopia. So amblyopia is not a very new condition to be known. We know the treatment of amblyopia since the 19th century. And occlusion therapy is one treatment that has been in practice since a very long time. So occlusion therapy, how in again in stroke, in the case of unilateral neglect, we in CIMT we restrict the normal side, making the abnormal side or the affected side to work more. Similarly, in occlusion therapy, the normal eye is patched. Okay, so as the affected eye or the lazy eye is made to work more. That is occlusion therapy. But although it's extremely effective, but we also see that it is very cumbersome for children, and when kids wear the patch and go to school, it's very stigmatizing for them. So it obviously has its own pros and cons. Next came the treatment of orthoptics, wherein they actually used to do a lot of eye exercises. But as we saw earlier in the signs and symptoms, amblyopia is not a condition which only affects the muscles, but a lot of other parameters. So this, even though this works out the muscles of the eye, but it does not really take care of the other parameters that are affected by amblyopia. Next is optometric vision therapy. So there are a lot of vision therapy centers that are still running throughout the country. They do show good results, but we see that they are pretty expensive. So it may not be affordable for all our patients. Then we see atropine drops. So atropine drops they use to blur the vision in the normal eye. So when the normal eye vision is blurred, the brain usually starts relying a little more on the vision formed by the lazy eye. In the 21st century, the smartphone applications and the virtual reality started. Uh, Therapists started using it for the treatment of amblyopia. Now, these are some of the options that were used until now for amblyopia treatment. Moving ahead to the second component. Okay. So when we talk about the old treatment approaches, we also need to remember that all these approaches may not be patient and parent friendly. There's a lot of cost that's involved in such treatments. It also gives a lot of screen exposure, and always it is not performed under the supervision of an expert. There are usually technicians hired in these centers wherein the treatment is overlooked by the technicians and not by the professional doctors or experts at all times. So, because of all these reasons, we usually see low compliance, which means that the patients do not really continue the treatment for long. So, which is why there is a need for different approaches to be started, and which is why we looked at exercises as a therapy for amblyopia. So, when we talk about exercises, what we do is we do repeated movements or repeated exercises, which will actually train the brain to acknowledge the work by the lazy eye, and that's how the neuroplasticity. Sorry. That's how the neuroplasticity will set in, and it will further prevent the neglect of the lazy eye. Along with that, we also need to remember that a multidisciplinary approach for treatment of amblyopia is required because all the previous studies that have been done on amblyopia shows that there is very little involvement of the ophthalmologist when it comes to the treatment of amblyopia. So, multidisciplinary treatment approach would be better in understanding the efficacy of our treatment. So the second component is the virtual treatment approach. So there are a lot of games or games on smartphone application that you all can choose and start working for the treatment of amblyopia. If you all search, you all will find a lot of games claim to treat amblyopia. But I've specifically chosen these three games because these are free of cost. They are available on iOS and smartphone both. Plus, they cover a lot of parameters that I earlier discussed in the signs and symptoms. So the three games that I usually use with my patients are lazy eye blocks, stereo blocks, and gamey bliopia. So it involves a lot of scanning, a lot of accommodation, a lot of near vision, a lot of convergence. We see a lot of contrast sensitivity activities. So a lot of these parameters are being taken care of when we play these games. There's also a lot of scientific research done on proving the efficacy of these games for amblyopia. Now, moving to the third component, that is the exercise therapy or conventional eye exercises for the treatment of amblyopia. Now, there are 15 games or 15 activities that I have enlisted, which could be done for the treatment of amblyopia. Again, these 15 activities are to be tailor-made depending upon the, or altered depending upon the age of the child. And also we need to make sure that it is changed from time to time so that it does not become very boring for the patient. Okay, so some of the activities, these activities actually cover all the 15 components or the parameters or the symptoms that I mentioned earlier. One is bouncing the ball. So the child is supposed to keep tracking the ball throughout while the ball is moving. Next is reading from a page. So it will involve a lot of glancing, wherein you can also ask the patient to find a word and the patient is supposed to circle it. So as in when you increase the difficulty level, you may decrease the size or the font size of given on the chart. That's how you increase the difficulty level. Reading from a Snellen chart, pendular exercises. So this will involve a lot of side-to-side movement, improving your peripheral vision. Drawing dots in straight line, then partitioning shapes into equal halves. So researchers say that children with amblyopia lose the sense of what is the center of an object. So here we start with bigger objects and slowly we start reducing the size of the objects and the child is supposed to mark the center of the object. So you can make the child mark vertically, horizontally, diagonally, any which ways. Identifying differently oriented letters. So the letters that seem similar like W, N, E, These are written together, and then you ask the child to identify the letter. So this again will involve a lot of fixation stability, a lot of scanning, a lot of accommodation, and a lot of convergence. So all these factors are taken care of while we do these exercises. Next up is focusing on candles. So we start doing this in a dim light, in a dim room, okay, and then we start focusing in a well lit room. Next is coloring inside the lines. So again, the lines are narrowed down as in when we want to increase the difficulty level. To circle the words, this is similar to what I spoke earlier. Working through the maze, we increase the difficulty and of the maze and reduce the size of the maze. Eye tracking movement. So we cover all the eye movements so as to work the eye muscles. Pencil push-ups and tracing the figure of 8, wherein the size of the 8 keeps on reducing. So these are some exercises that I have enlisted that we can do for children with amblyopia. The last up is in a dark room, we make shapes and letters with a flashlight, and then we ask the child to identify it. So why would these treatments work? So these are some of the reasonings why probably these treatments could work. One thing that we need to remember is when we train children, their brains are very elastic in nature, and therefore they can be retrained easily. So the earlier we start, the better it is. We see that exercises, I'm talking about the first line here, the exercises release a lot of endorphin, and endorphin causes analgesic effect. So it eventually reduces the headache. We also see that exercises cause a lot of eye muscles to work. And when eye muscles work, there is a lot of eye movement. So because of that, there is an increased ability to focus on different points, to scan, to focus, to react on various objects. It also, when we give side-to-side movements, there is a widening of the visual field. So that takes care of the peripheral vision. Scanning and focusing takes care of the near vision. Focusing from different points improves your visual acuity and your accommodation. So this is how the exercises could help treat amblyopia. Apart from that, we also see that when we give a lot of repetition and when the neuroplasticity sets in, we are actually training the visual cortex for various reasons. One, to adapt the eyes together, and with that, the convergence is taken care of. Also, we need to remember whenever the convergence is taken care of, we never would see double vision occur. Next, the refractive error cannot be completely treated, but what we can remember is we can teach the child to work with whatever deficit he has and make the child to learn how to make maximum efficacy out of whatever he has. We also can teach the child how to discriminate from the information that he receives from the sheet, so that will take care of the contrast sensitivity. Now, these are some of the points that we must remember. These treatment approaches, so I already spoke about the older treatment approaches, the pros and cons of the older treatment approaches. This is specifically for the eye exercises and the virtual treatment mode. One, that is, it is very compliant. So this is very interesting for the patient. So the children usually tend to keep going with these therapy sessions for longer. And that is why there are more chances that the child will improve since they're taking therapy for a longer time. Apart from that, this is very cost effective. It does not involve a lot of cost. It includes a lot of mind games. It could be carried out at home without any fancy equipment being present with the parents. It works a lot on the eye-hand coordination. It is very fun filling for the kids. And we must also keep an ophthalmologist always on a team while giving treatment for amblyopia, while following up for the prognosis of the kids, so that they can give us inputs on how good or bad we are progressing with the child. We must also always bring novelty and creative thinking in our therapy, because the 15 games that I mentioned, even in those 15 games, we could give different tasks every time, and we could make something creative out of it, so that the child does not really get bored of it. We must look for appropriate screen time. So there are these AAP guidelines, American Academy of Pediatrics guidelines on screen time that are already given. So it has guidelines which state the age-wise time period that is appropriate for a child to have a screen time for. So we must keep that in mind and accordingly draft a program treatment protocol for our children. And also, we must take care that while we're giving treatment with the virtual therapy, we must not let the children get addicted to their phones. So that's all from my end. In case you all have any questions, or if you all want to discuss anything further on the treatment of amblyopia, you all can get in touch with me on these handles. Thank you. All right. I am done, ma'am.
Rupesh, you there?
Sorry.
Hello? No,
Yes.
I'm not talking to you. I'm asking Rupesh sir actually.
Yeah. Sorry.
Anyways, you have presented really well. Within a very short period of time, you actually prepared and presented to us. It was really a very nice presentation from you. I would like to thank Professor Dr. Ali Irani, Principal of NMIMS Mumbai University and Nanavati Hospital. He is also related there. And I will thank whoever have helped you somehow in and guided you to present this. See you in our upcoming sessions. Stay with us. Thank you. Bye-bye.
Thank you. Thank you so much.